Welcome to this edition of the Team Science Virtual Seminar Series, sponsored by the New Jersey ACT's Team Science Core. My name is Dan Horton. I'm one of the Team Science Core co-leaders, along with Nancy Reichman, who's here today, as well as Ralph Gelati, who sends his regrets. So as some of you may know, the seminar series features different teams doing biomedical research across the New Jersey ACT's Consortium, and we're focusing on high impact transdisciplinary research teams. Now, in other seminars in this series, we've focused on federally funded projects through mechanisms promoting various large team science efforts. Today's team and project are not federally funded, not yet at least, but still are doing really innovative and high impact transdisciplinary work with substantial funding from a non-federal source. We'll hear about them and certainly about their project shortly. Just in terms of the context, as with other of our seminars, we'll first ask the guests to provide a high-level overview of their project, and then we'll ask questions about various aspects of the team-based research they're doing, including advantages and challenges of interdisciplinary team research, important competencies for leading effective research teams, and useful strategies for fostering effective collaboration. So to introduce today's guests, I'll turn it over to Nancy Reichman.
Okay, thank you, Dan. So today we're going to hear from three people. Joel Cantor is a distinguished professor of public policy at Rutgers, the founding director of the Center for State Health Policy at Rutgers, and a leader in health policy research and development nationally, with a special focus on informing policy in New Jersey. And we'll hear about that today. Dr. Cantor has published widely on innovations in health service delivery and the regulation of private health insurance markets. He serves as an advisor on health policy matters to the New Jersey state government. He also serves as a member of the executive committee of the Rutgers Institute for Health and co-leads the community health and health systems emerging signature area for Rutgers Biomedical and Health Sciences. William Hu is a board certified neurologist with special certification in behavioral neurology and neuropsychiatry, and an associate professor and chief of cognitive neurology at Rutgers. He's made significant contributions to the field of dementia research. Early in his career, he identified the brain region in Alzheimer's disease, where a pathology more commonly seen in frontotemporal dementia and amyotrophic, I hope I said that right, lateral sclerosis, or ALS, first appeared. He subsequently developed a reliable diagnostic test that has significant implications for the diagnosis and treatment of Alzheimer's disease in Black or African American individuals. It's our pleasure to welcome these two distinguished scholars and hear about how they will be combining their expertise and interests in the development of the New Jersey population health cohort study. Also joining us will be Margaret Koller, the executive director of the Center for State Health Policy. Joel, if you'd like to provide a more detailed introduction to Margaret, please do so now. In any case, I'll pass the baton to Joel to start the presentation. Thank you.
Sure. Let me just add to that introduction that nothing at the center works without Margaret's help, including this study. She's involved in as a policy leader in New Jersey, as well as the sort of chief administrative officer of the center, and so much more. I'd fill up the time with her accomplishments. So shall we launch right in?
Yes.
Great. I will share some slides. Okay, well, thanks so much for inviting us to be here today. We're really pleased to present to the group, and it seems like an auspicious time to do so, as you'll see as we go. As we all do, we start with our acknowledging those that made all of this possible, describe our team. As Dan said, we'll then describe the study at a pretty high level, and then talk about our sustainability strategy, which really leans heavily on team science, as you will see. So acknowledgements, Dan had the teaser. This is funded primarily by Robert Wood Johnson Foundation, with additional support provided by Chancellor Strom and our RWJMS. We have tapped the expertise of many, many people around Rutgers and beyond in the design of the study and to advise us on implementation. So we want to thank them. None of this would work without a really dedicated, talented staff of folks who, many of whom come from the populations we're studying, speak their language literally. That's a really talented and diverse staff. Likewise, our community partners are essential for this work, as you'll see as I go through the project. And of course, we all thank the participants in our studies, and we are really grateful for their willingness to share their time, and importantly, to really talk to us about some rather sensitive and personal things. And none of this would be possible without all of the above. So here's our leadership team. You've met William and Margaret and me. I'll go to the next slide where I describe the team a little bit more. So as Nancy said, I'm a health policy and services researcher. Paul Duberstein is a clinical and community psychologist. And he's professor and chair of Health Behavior Society and Policy at the Rutgers School of Public Health. You heard about William. Don Mouzon is a colleague from medical sociology here at Rutgers. Michael Yedidia is a member of my center, another medical sociologist. Steve Cohen is at RTI International. He's a sampling statistician, I think one of the best in the country, who is advising us on sampling matters. We are also recruiting, hopefully a fairly senior team member, but we're open to many kinds of applicants with an emphasis on epidemiology, demography, population science, people with cohort experience. So if this seminar generates some good CVs, I'll be really delighted. So just feel free to reach out if you know folks. So turning to what this study is. So our overall goal is to produce actionable information for improving population health, well-being, and health equity. Our sponsor, Robert Wood Johnson Foundation, is very interested in New Jersey as a place, and they're really deeply interested in questions of health equity. So you will see the emphasis of our study that attracted them to fund it, and also we're trying to be responsive, and we share their goals. The specific aims are to discover ways that stressors over the life course at various levels, personal, interpersonal, intergenerational, societal levels, contribute to health and well-being. And secondly, we want to identify factors that either mitigate or amplify how those stressors influence health and well-being. This is our conceptual framework. I'll leave this up for a minute. We really draw on the great work of Nancy Krieger and company in the eco-social model, her eco-social model of health. And it's also informed by Berlin's sociology of stress related work, and the NIH, NIMHD, Minority Health and Health Disparities Institute research framework. Various levels are working on over the life course with stressors at many levels and possible amplifiers and buffers at many levels, with really quite a broad range of outcomes. I think a little bit broader than most epidemiologic cohorts, which can be a bit challenging. So turning to the quick overview of the study design, our aim is to recruit 10,000 individuals in New Jersey, age 14 and older, who live in the community. So we're excluding institutionalized people. The sample is split 60-40 between a probabilistically selected group with a modest oversample of multi-generational families and people in minority and low-income households. Within multi-generational families, we'll recruit more than one participant. Hopefully, that's the aim, across generations. The other 40% will be specific immigrant groups or immigrants writ large, with an emphasis on specific groups that are listed here. And because they're fairly rare in the population, probability sampling is not feasible. So we use respondent-driven sampling, which is essentially a snowball style referral system. And again, multiple individuals sampled within families, so we can address intergenerational questions. The baseline round of data collection is from the sources listed here. In-depth interviews using validated psychometric measures where possible. We have designed a few new measures. Activity and movement measured with actigraphy watches and GPS devices in a subgroup for now. We also biomarkers, so DNA measured in saliva from everybody who's willing to provide it in the cohort, and a subgroup will be asked to give blood for further biomarker work. Both will be banked and available for analysis. Also, we're planning really quite extensive secondary data linkages, both at the person level and at the area and neighborhood level. So in terms of actigraphy, we're for participants who agreed to actigraphy, we'll be using watches described here with a 2-week data collection period, measuring sleep and movement, physical activity. We give them a cell phone where we learn where they go, their speed, and so forth. And we also have it, using the phone, we use a daily activity and sleep questionnaire to support analysis of really what is a fire hose of data coming from these sources. Biomarkers, and I'm going to turn to William now to talk about this because he's really leading this part of the study.
Thank you, Joel. So because we're interested in health outcomes, and not just cross-sectionally, but also longitudinally, one of the risk factors that are best known for some of the diseases of interest are genetic risk factors. So we are collecting salivary DNA from all consenting participants, and we're expecting approximately 80% consent rate based on the experience to date. And for each sample, we will send a sample for DNA array genotyping. So we're expecting to get back about 800,000 SNPs per individual. And the power of this is substantial, both in terms of the depth of genotyping as well as the diversity that we're including in the New Jersey cohort. In the ideal world, we would also collect blood and other biological samples from 8,000 people. But from a logistic perspective, that is quite beyond the scope of what we're able to manage. So what we have proposed is to collect fasting plasma for now from 2,000 individuals, and in whom we're going to measure a panel of inflammatory cytokines, because inflammation, both acute and chronic, have been implicated in stress response, as well as, of course, over the past 3 years, some of the more common diseases, including COVID. Because of my personal interest in the Alzheimer's disease and this emerging blood marker that could potentially indicate pre-symptomatic or asymptomatic deposition of Alzheimer's related tangles, We're also going to measure plasma p-tau levels, phosphorylated tau levels in as many people as possible. And how we came to the design of the sub cohort, the sub biomarker cohort, is that we want to include people who are very much interested in participating in other additional future biomarker studies, such as MRI, add-on MRI studies and add-on microbiome studies, because we want to be able to reach them in the future in subsequent waves. We prefer that they have stable living situations or stable contact information. And for people who are unable to have some of these future add-on biomarker studies, we're going to exclude them from this first wave. Again, certainly in the future, we can consider including them. And because one of the major biomarkers of interest are inflammatory changes, for now, we're also going to exclude people on active immunosuppressant therapy with active cancer or one of the chronic infectious diseases. And again, they can be formed as subgroups or as sister groups to the cohort study. But for now, just to get a better understanding for characterizing the landscape of biomarkers in the New Jersey cohort, we're going to select a fairly small and highly selective group of 2,000 individuals.
Thanks.
Joel, I think I'll pass it back to you.
Okay. So turning to the data linkages, as I said, I think we'll probably have a richer set of linkages than most studies of this kind. And it really builds on work that we've done at the center and that is going on elsewhere at Rutgers to develop administrative and other secondary data sources. I won't read the whole list to you, but you can sort of scan it and see the kinds of things that we will be linking. Our aim is to link historical data back to about 2017 where feasible from all of these sources, possibly earlier if there's a good scientific reason to do so. And then we will also be doing the area level linkages. I'm not listing those data sources here. We have the luxury of time, of course, because one doesn't need additional consents and we will have the geocodes to be able to link. So those will be determined, those data sources will be determined by specific analytic needs. The next few slides go through the measurement domains. And again, I'm not going to read all of this to you. You can always, since we're asynchronous, you can always hit pause if I'm going too fast. But a range of health and well-being metrics. The light blue here would come from some self-report, but also from the secondary data linkages. Of course, mortality is never self-reported, but you get my point. The measures of stressors, both perceived and quote objective measures of sources of stress, early childhood adverse experiences, and you can just sort of look through the list that we are both asking folks or in some cases able to get through data linkage. Sociopolitical and societal stressors, and again, this is something that is I think goes beyond most cohort studies to try to measure stress at these higher levels of influence, social media, climate, and so forth. Not just whether the people feel that they're affecting their lives, but how much sort of existential worry they have about these things. Social determinants of health, environmental and neighborhood characteristics. Potential buffers and amplifiers, and I should say some of these domains can move between, from slide to slide here. They can be stressors or they can be stress buffers or amplifiers. But but personal traits, relationships, health-related behaviors, healthcare access and use. And then, of course, we'll measure demographic factors, and importantly for our sample, highly detailed information about immigration, and then, of course, socioeconomic status. So a very quick overview of the timeline. We are in the field with the study now. The probability sample is being fielded in 3 self-representing replicates. So they are random samples of the random sample. We expect to wrap that up probably the end of the year, early first thing next year. That will be followed by replicates 2 and 3, each spanning 6 or 7 months of data collection with the complete data in place in 2025. One advantage of doing the replicates is that we would have sort of low power but broadly representative data for preliminary studies early in the process, which can then be used in running proposals. The immigrant samples aren't being implemented in replicates. It's full steam ahead recruiting those groups now and throughout the period. The biomarker work, we're collecting saliva from everybody who consents, as we've said. William has led a pilot study of biomarker work, making some important comparisons to help us design the full-scale collection of the 2,000 cases, which we will complete in replicates 2 and 3. The GPS actigraphy is underway. And the secondary data linkage at the personal level, we're getting consent from everybody at this stage. And we are in the midst of negotiating access and data use agreements with the various owners of the data. And then the geographic level data to be developed down the road. So it's worth a mention of the importance of engagement, community and scientific engagement that is built into the study, a community advisory board that will advise us or is advising us on our recruitment strategies, building networks to effectively recruit, community engagement and outreach strategies, how do we reach them, analysis and dissemination priorities when we get there. We have an active team working on outreach into the immigrant populations of interest and other groups that have interest in the study. We are now currently reforming our scientific advisory committee with an emphasis on not just scientific advice, but advice about sustainability of this work and adding additional rounds of data collection and finding funding for that. And there's a range of additional outreach activities that we're involved in because we're interested in state policy, because it's a New Jersey study, because our funder is interested in New Jersey, because New Jersey is a potential funding source. We do a lot of outreach and socializing of the study with legislators, administration officials, and other stakeholders. So the last big topic here we'd like to discuss is our team science approach to sustainability. So as we said, Robert Wood Johnson and RWJMS are funding the study now. We estimate, give or take, that about 80% of the expenses are covered by the grants in hand. So over time, we do need additional infrastructure support, even for the baseline data collection. And neither party has, well, both parties have said, this is it, don't expect more from us, maybe some project funding or whatnot. But we are not looking to RWJF or Chancellor Strom for ongoing support. So how do we fill these gaps? Of course, the leadership team will be seeking infrastructure support through NIH applications. But on the team science front, we are working to identify experienced R01 level investigators, folks who have already succeeded many times, whose interests align well with the cohort to lead specific R01 studies, R01 level or similar proposals to build on what we have so far. They could be targeted to any relevant institute. This is a list of just some that we think are relevant in the short run, or other potential sources. They'll have the opportunity, if the case is made that it's likely to enhance the probability of getting the award, to add selected interview items to our instruments. We'll provide preliminary data for them based on replicate 1 to make the case for their proposals. We have the expectation that they'll help fund the infrastructure in return for really joining the team and using the resources that we've built. We also, a little bit further down the road, want to do what we can to support early stage and new investigators through pilot funding, if we can find the money, and to waive the sort of requirements for helping to pay for the infrastructure of the study. To give folks a leg up on their first submission. Also, as I mentioned, we're doing quite a bit of outreach to New Jersey stakeholders and other possible funders, which you may one day yield some support for the core infrastructure here. So turning back to the R01 ready investigators, as we call them, we have several sort of in the early stages of thinking to be submitted probably in the coming year, plus or minus. These are some of the topics that folks are exploring. I will say this is a very preliminary list, that the description of the topics are in my words, not necessarily theirs. But this gives you a sense of the range of topics that we think the cohort provides some strong advantages to support. We're really hopeful and optimistic that at least several of these will be submitted in 2024. Very highly competitive R01 or similar applications. We do have the expectation that these, in exchange for access to the rich data that these will also help support the infrastructure of the cohort. The expectation is that if they're doing extra work, it comes out of their grants. So if they're doing sort of follow-up interviews or additional testing of the biosamples or the saliva, that they would cover those direct costs. In addition, we expect that they would cover some of the core infrastructure costs, potentially additional rounds of data collection. This could be structured in any of a variety of ways that's scientifically justifiable and meets the requirements of the funding entity. And finally, we would like us all to sort of have a sense that this is a resource for advancing science and not just advancing, one lab's agenda. So any new data collected would be part of the collaborative with governance of release of those data jointly by the cohort leadership team and the leads on the respective R01s. We're working on the details of sort of fleshing this out. We want to be very transparent with our collaborators, but this is the bare bones of where we're going with this. So with that, I will thank you and open it to questions from our vast audience in the room, meaning Nancy and Dan.
I have a question. So your funder is clearly interested in New Jersey. How will you sell New Jersey to the feds? I'm sure you have thought about this.
Sure. So New Jersey, this is the story of my academic life, right? Because my center does a tremendous amount of work with New Jersey data. Turns out New Jersey is a really interesting place. Our populations is among the most diverse in the country. We have, depending on what metric you use, we have about the third largest immigrant stream across the states on a per capita basis. That's, of course, one of the strong emphases of this project. We have, over the years, developed really quite excellent sources of secondary data that can be linked. So we're going to play up all of those advantages. Would we be better off if this were a national study? Of course, from a funding perspective, from a generalizability perspective, but we think we're if we had to pick a state, which was a good one.
Yeah, and if you were in more than one state, it would be very complicated to link all those funding sources. So that's a strength by sticking to one state.
That's right.
I guess I'll ask the next question, which is a question we try to ask everyone presenting at the series. So, and this is for any of you, and maybe all of you, if you can comment, what are some of the advantages as well as the challenges associated with having such a diverse research agenda and team, and performing this kind of multidisciplinary research?
I guess I can start, and then I'll invite my colleagues to chime in. So ultimately, as this becomes longitudinal, we hope that we can really address some questions of causality about the impact of stressors and stress mitigators and amplifiers. And no one discipline has a monopoly on the predisposing and response kinds of questions. So we absolutely need the strong biological and perspective that William brings. We absolutely need the strong psychometric grounding that Paul brings, the conceptual framework and the sort of social factors assessment that Dom and Michael bring, and so on. So if one wants to have a comprehensive causal model, where one needs the ability to measure all of those things rigorously. So I think that's the principal rationale for this. Plus, we like working together. That's a good one too. Anything else to add, Margaret or William?
Yeah, I think I fully agree with Joe on that, which is that if you look at the NIA or the NIHMD health disparities framework, there are 4 pillars, and biological is only one of them. And I think in many, medically based specialties, we focus on biological a lot and not taking into account the big environment, which is not just the air you breathe, the water you drink, but also the other people you interact with, the societal challenges, as well as the resources. And then so for something like this, we can really start to look at some of those interactions in more than superficial ways. And I think, that's also the challenge, because I think in biological sciences, there's the assumption that everything else remains the same. But now we have multiple variables happening at different levels, happening at different times as well as the same time. And how do you analyze data like this? It will be fun to figure out. I can't say that we have it all figured out yet. But there are a lot of unknowns, but it's, that's why we get into research, that we can try to find a way to answer these questions.
And I think, Dan, one of the things this project has evolved, and the design of the cohort study has evolved tremendously, particularly over the last year. And the work has been so much richer because of the diversity of the project leadership team and the expertise of the investigators. And you have to be open to that. You have to be opening to listening to people who have expertise in a complementary area or somewhere that may not be one person's wheelhouse is in somebody else's wheelhouse. So, and you have to have tough conversations about trade-offs. We can't do it all. We came to that, that you come to that understanding pretty quickly. But I think the work is so much better off where we are today because of the collaborations that we have, slogging through, letting go of things, moving on, being willing to say, we thought we were going to go left, now we're going to go right. And it's a process. It's collegial. It's having those tough conversations and the respect to bring people and teams who may think differently about issues because of their expertise, and that makes it fun, and the work is better for it.
Can I just follow up on that? I mean, you talked about kind of differences of opinions and potential conflict. Can you talk about how you've handled those areas of conflict or disagreements to kind of move forward and make the project stronger?
Sure. Yeah, that's a great question, because these things inevitably come up in a project where people bring such diverse perspectives to the table, and frankly, they have come up for us. My strategy is as much as possible to work on a consensus basis with the leadership team, the folks listed on that early slide, which means sometimes things take longer and we get a little delayed in the work. At the end of the day, of course, compromises are needed, and we can't always reach consensus on every aspect of this. So then, sort of working with the project leadership team, sometimes we just have to decide, but really only after everybody's had their say, and we do our best to accommodate each other's perspectives. That's fueled on goodwill, and it won't work well in every team, but it works well in ours.
Yeah, I think we have learned to not be too bullheaded at the individual level. This is not my R01. This is not Joel's R01, where one person just gets to make an executive decision. And I think that this is a collective effort. And I think along the way, we've become, I hope, better scientists, because others from different perspectives have opened our minds about our own science.
And I want to work with people who care enough to push back, and to enlighten me and teach me. And, again, I'm not on the scientific side. My role is very different than Joel's and Williams, but trying to be a facilitator in some of these conversations to the extent that I can that's, I think, for most people that is invigorating, right? You don't have to be right. You want to get it right. And getting it right isn't always easy. And I would also say we spend a lot of time together now. We average 3 or 4 meetings a week, just on Cohort. We have different huddles. We have, I probably have, William and Joel and I have probably spent more time in the last year together than I don't know that I knew William until probably, 8 or 9 months ago, 10 months ago. It takes time to get into a rhythm to build a team. And it takes some effort, and it takes some care. It takes the patience that Joel has demonstrated in trying to lead a diverse group, right? And trying to come to consensus. And I certainly give him a tremendous amount of credit for that. But like any relationship, you have to put something into it and be willing to take a step back when you need to and take a step forward when it's called for.
So you're essentially, it's hard. Interdisciplinary or transdisciplinary research is really hard. You're putting people together in the same room that speak different languages. And, I just would like to hear about, if you have any communication issues or tips, or, how do you get everybody to be aligned? Because people really have really different expertise.
I think we all view the NJ cohort as sort of bigger than any one of us. And William alluded to this when he said, it's not me as PI or Joel as PI, but we're trying to build something that's going to have some staying power when we've moved on in one way or another. And it has to be sort of well-grounded in multiple disciplines for that reason. So in sort of keeping that vision in mind, we ask, as we interact over these issues, we ask, okay, what is going to make this, frankly, fundable by the right NIH institute or some other source? What variables does it have to have? How does the conceptual framework have to tick? Or it'll be a non-starter with NIA or whatever it is. So, sort of trying to keep an eye on the sort of distant ball, I think really keeps us all motivated. And beyond that, it's just willingness to sort of hang out and talk it through. I'm not sure what else I could add.
Yeah, I think it reminds me very much of an NIH study section when you have a group of very smart and accomplished people, all coming from different institutions and different scientific backgrounds, using words, the same words that may mean very different things in different settings. So I think we all wish that we had come in with a standard set of glossary, but that's not how science works. And, thankfully, we have not gotten to the point of defining what is, but I think we've refined many other terms that are seemingly straightforward, just so we have scientific precision.
Mm-hmm.
Good point.
So I'll go to another question we like to ask all groups, which is if you could name some of the competencies that you see as necessary for leading effective research collaborations.
Patience, listening skills. I don't know, William, Margaret, what else? Obviously, sort of scientific chops, but beyond that.
I think listening more than hearing, and because I think we are all used to extracting the most important information out of a particular presentation in our own scientific framework. And then again, this is like listening to a new language. And then so I think we really need to listen harder than saying, yeah, I heard it. I think we really have to listen harder. Other competencies, I think it's willing to give some, and I think I think with every collaboration, it's a little bit of give, a little bit of take, and understand and remembering that at the end of the day we have a common goal.
It's the flexibility. It's also not getting stuck. It's letting things go. So when something doesn't work or something, you feel like, wow, we spent a lot of time on that and, it didn't fly. You have to have a short memory because there's so much to do. And it's a delicate balance because you want to have enough retention to say, I learned from that. Let's keep moving. Let's make that a useful experience, but you have to keep moving and not getting stuck or mired in something because you saw with Joel's description, there's so many components of this project. And for myself, when you sort of break it down, you're like, holy cow, how is all of this? There's a lot of planes up in the air we're trying to, bring home for a landing. And I think it's really just taking it in some sweet sequence, moving through the issues, knowing that some days are going to be much easier than others, and just trying to keep making good decisions that you're accountable for. And that's the thing on this team. There is no absence of accountability. And that's a nice safety net to walk on. Nobody's saying, oh, this is your problem, Margaret, or your problem. There's a collectiveness here that I think makes it a little bit easier to kind of slog through some of the other stuff, frankly.
I would like to add one other to that, and we're focusing today on the scientific leadership primarily, but an enterprise this complex does not work without strong administrative competencies as well. And Margaret and our project director, Stephanie Bergeron, and the people who report to them on the financial side and on the IRB work. And it's just something that is this complex with this so many moving parts, where you're asking people questions about their personal suicidality, et cetera, just needs sort of strong administrative competency, ability to navigate the complex bureaucracy, and frankly, not always responsive bureaucracy that is the hallmark of many large research universities. And ours is no exception. I can't emphasize enough how administrative competency is really core competency for this work.
Margaret, do you want to kind of elaborate at all on some of those other kind of administrative competencies that you see you practice that you haven't mentioned?
Yeah, no, I just think, having a good work plan, having really good people who you can bring in and delegate to. I think just never assuming that things are being handled. You have to, it's a challenging environment. I don't think Rutgers is terribly unique. It's a big bureaucracy. We understand that. And, just communicating well. I think communication is obviously core at most of the work that we do and fundamental. You take things for granted until they're not done well, and then you realize how important they are. And I think for our team internally, administration should never really be a headline on a research project, right? I would say that, we're not doing our job well if that becomes the highlight when you're doing this kind of work. That should be kind of, I think, in the background, being done pretty smoothly. And our job is to give brief updates to let people know that everything is under control. And that makes me happy when there's no news about administration and operation in that respect. And just let other people, the scientists, do their job well.
And all of this is done under pressure, right? So we are now staffed up with about 15 or 16 FTEs, including the interview staff and the data staff and the investigators and so on. And with our lavish fringe benefit rate, payroll is expensive, and taking time to make changes and manage the everyday work of the cohort, you feel the pressure because you're burning money. So we have $10 million at the beginning of this, and folks say, gee, that's a huge amount of money, but it is not when you're doing something this ambitious. That, just emphasizing the sort of real-time needs to make scientific decisions, and the willingness of the leadership team to spend the time, and the administrative staff to sort of keep things running and implement changes in real time. It's all, we sort of use the metaphor, we're building the plane while we're flying the plane, and it sort of applies in this case.
And Dan, I would also say that, you have to, our team has, again, I can see this evolution of working together as an example. We're monitoring some pretty large contracts that are supported for Williams' work for the biomarker. There are some black holes in terms of, I'm not familiar with some of the details and what we should be estimating and encumbering on budgets. And I said to him, can you take a look at this? And mindful of, I don't want to waste his time on stuff that he doesn't need to be worried about. And that's my job. But in 5 minutes, sending him a spreadsheet, he took a look, wrote some notes, and said, this is what I would do, encumber this. Being respectful of his time, so he's not wasting it doing things that he didn't, but understanding the sweet spot. I need your feedback. And anytime I have asked for that, he's given it to me. And then my responsibility and others, the administrative team, is to make good use of that so that the management is better informed in the decision making. And I think that that's critical. And we're very fortunate to have accessible investigators who will lend their expertise. But that also comes with being judicious about the requests that you make. PIs don't want to get bogged down with this stuff, and that's understandable. So.
And I cut $800,000.
I noticed that. I was
So
Yeah.
you have to understand who to ask what, when. So that's very tricky. I just had a very straightforward question. Maybe you said it and I missed it. Are you using a survey contractor? Who's collecting the data?
So we are using a survey contractor in the probability sample to do initial recruitment and what we call enumeration. It's sort of a screener interview to determine eligibility. One of the hardest things to do, and I mean, probability samples these days are enormously challenging. Nobody answers their phone. People throw out their mail. You know, national polls get 3% response rates. So it takes a huge effort. So we've hired a professional firm that does that well. But then they hand the cases over to our team, and our staff administer the rather lengthy interviews using those psychometric tools and doing, you know, collecting the saliva samples and running the consents and so on. So that's our internal
So
team.
they identify the cases that you approach, or they approach the cases and then they're in your sample, and then your people do your thing with them, which
They approach the cases. So that's a enormous task, because you have to go to tens of thousands of households to recruit 10,000. And then they hand them off to us once they have that sort of basic, like 10-minute interview done, 10 or 15-minute interview done. And then we do the much longer interview and all the other measurement, consenting and other measurement with our staff.
Are there any, how's that handoff? Does it work well? Has it worked well, or do you lose people?
Well, we don't quite know yet, because we started by doing all the recruitment in-house ourselves. And it proved to be really infeasible with our small team, without the systems, and frankly, without the expertise to make cold calls and recruit people. So we're only now turning to onboarding the vendor. It's a firm called SSRS. And so ask me again in about 6 months.
Okay.
But, you know, we internally refer to it as sort of turning on the fire hose of respondents. So instead of spending hours recruiting one, they'll take somebody who's already given a preliminary consent, reach them, do the longer consent, and so on. So we're bracing ourselves, our staff are, for that phase.
You had mentioned, Joel, earlier about engaging in the community, engaging with stakeholders. I'm wondering to what extent you have or you consider certain stakeholders part of the research team. And this is for anyone.
Yeah. You know, we believe very strongly in having sort of bidirectional exchange, particularly with the community advisory folks. And we had a couple of false starts, frankly, on that front. And then with some change in leadership and so on, we pivoted, and we feel pretty good now where we are. And are recruiting cab members. We have a consultant, but we're recruiting others. And I think we all feel like we want them to feel a sense of ownership over what we're doing, but we have a little bit of a disadvantage in this case of saying, welcome to the cohort study. We really want your input, and the study is already designed in the field. Yeah. So, we have a little bit of ground to make up on that front. I would say our leadership team was selected in part because of scientific expertise, of course, but we also bring diverse personal life experiences to the process. Could we be more diverse? Of course. We couldn't possibly have an investigator team diverse enough to reflect the experiences of all of our participants. But we have folks who have a lot of experience, personal and research-wise, with immigrant populations, for example, with African-American populations, and so on. So we think we have, strong investigator team diversity on that front, which is really valued and important, but not sufficient.
Yeah, I just want to add that I think there's another level of language barrier there in terms of what being part of the research team means, either to us or to the community members. We've been doing quite a bit of community-based work, and there's a lot of misunderstanding because expectations are not clearly communicated. So with the support from the NIH, we developed kind of a community partnership toolkit, which is something you can hand to the community partners so that they understand when we say something, what the terms actually mean, even when they are afraid of asking. And then also helping them understand what type of commitments we're expecting so that we don't end up with a sour relationship a year from now. I think regardless of whether we're out there recruiting for our own studies or we have a firm that's engaged to say that this is a study that Rutgers is conducting, and the reputation of the university is critical in engaging people in a study like this, of this scope. And then so we really want to make sure that we're engaging people appropriately and respectfully so that we don't make them believe that they sign up for something only to find out that it is not what they thought it was.
Yeah, in our CAB, for example, the Community Advisory Board, we have, it's still in draft form, not quite ratified, but we have a charter document, an agreement that lays all of this out. What are their responsibilities? What are our responsibilities? What are our expectations? What are our goals for the community engagement work? All very explicit. You're not going to, well, put it this way, you're less likely to disappoint folks if they know going into it what we're hoping for and what we're willing to give.
I wish we had more time to learn more from you and your experiences and this project. But I just wanted to thank you, Joel, William, and Margaret for taking the time to share your experiences and your insights in your project and in team-based research. This is an incredibly thoughtful and impressive project that will no doubt have tremendous impact in the years to come. Take-home points for me: I heard the importance of consensus and compromise, the role of patience and certainly communication, responsiveness and accountability. And I really like, Margaret, your comment, you don't have to be right to get it right. So thank you for sharing those and many other insights. And just for everyone who's watching, if you have other questions about how to form or organize your own research team, or how to improve team dynamics or performance, or get other resources on team science, please visit the NJACS Team Science website and request a consultation there. So thank you so much.
Thank you. Bye-bye.